Hi, everyone. Colette Cordion here. I'm the founder and CEO of Joylux, and we are delighted that you have joined us today on this incredible women's health panel that I am leading here. I have two amazing doctors here that I will introduce in just a second. But I want you to know this is an interactive show, so please send us questions. Anything that's on your mind about menopause, about women's health, about intimate health, VFit, Halle Berry, you name it, just go ahead and ask us. We do have some questions that already came in over the last week while we were promoting this. So I'll read off some questions that we got from all of you, but don't be afraid to ask anything you want. So before we get started, I am just so privileged to have these two amazing women here, Dr. Kathy Fields and Dr. Sarah De La Torre. For those of you that know, Dr. Sarah De La Torre is an important part of our company. She has been with us at the beginning as our Chief Medical Officer, but she is a very well-respected OB-GYN. I'm going to read some of her accomplishments because they are too numerous to memorize. You're a board-certified OB-GYN, and she is certified in functional medicine, which is all that natural stuff, which is also very, very important. She has practiced for over 25 years and has delivered 4,000 babies, including my own son. So that's how I first got to know Dr. Sarah. She is a certified NAMS provider. NAMS is North American Menopause Society. If you don't know what that is, you should. It's a great group of folks that specialize in menopause care. You are a fellow of ACOG. You speak internationally. You are a published author of clinical and research articles in women's health, and you provide a real functional approach to nutrition, aging, and hormone and wellness. She's constantly telling me all the vitamins I need to be eating, taking. All right, well, we are delighted to have you here with me. And then, oh my gosh, this woman here, Dr. Kathy Fields, she is a legend. She is a legend. First and foremost, you are still a practicing dermatologist here in San Francisco, which is where we are. But for those of you that know who she is, you probably heard from her first with Proactive Solutions, that incredible acne brand. She and her partner are co-creators of Proactive that every teenager has used at one point in their life. And then you and your partner went on to be the co-founders of Rodan and Fields, the #1 skincare brand in North America. And of course, hopefully those of you out there have tried the products. It's beautiful. What most don't know, though, is you actually started your medical profession or your career in OB-GYN residency.
Correct.
See, so we're going to get a little bit from the derm side, but the OB-GYN side too. You completed your residency at Stanford University. You are also a clinical associate professor of dermatology at the University of California, San Francisco, and an adjunct clinical assistant professor at Stanford. I mean, there's so many impressive things about you. I literally could talk for hours. In fact, I met Dr. Kathy at a dermatology show several years back, and she truly is a rock star and a legend in her field. So thank you so much for being here. And let's just start the question off here, because you are a dermatologist. So why are you sitting in on a talk about women's health?
Great question. I'm here because I still practice, and I know a secret, and it's a big secret, because women are suffering, and they're suffering every day. They have no one to talk to. They have no idea what's really going on, and their resources are sketchy. TikTok? Really? So when I see patients, I ask the questions their gynecologist just may not have the time for. And I really go deep. So starting 40, 42, all the way to 78, whatever, numbers higher. How are you sleeping? How are you feeling? What's going on? What's your relationship with your husband? And the answers are startling, even from my patients who are physicians. We're suffering. We're suffering gravely. And we don't even know where to begin, or that we're entitled to have an answer and to feel good in our bodies, not guilty in our bodies. So when you approached me, I couldn't wait to be involved because I know the secret that women really suffer. And you presented to me an opportunity to help people. And that's why I still practice.
Oh, I love that. I love that. Well, let's just jump right into some of the questions we got. And we're going to talk about menopause broadly. We're going to talk about intimate health, because that's one, of course, that we are very near and dear to our hearts. But let's just jump in on aging, menopause, and the effects on your skin. Let's just start there. Talk to us about what's going on as we're going through menopause.
Deep breath, everybody.
Hold on.
Feel it.
Yes.
Yes. It's going to be a long answer, but maybe not. Your body is changing. Your hormones are changing. And there's so much going on in your body that it is complicated. And you need to understand there is genetics, there is your environment, there is your diet, and then add stress, add sugar. And so all of this is happening on top of your telephone going off every 3 seconds with world events, your kids calling, your husband's got issues, your mother-in-law is making you nuts. When you put it all together, your body is technically degrading. Mm-hmm. We're not getting out alive, just letting you know now.
Yes.
But can you go, but you can go well. You can go well, and you don't have to go quietly into the night. So there's so much
hope, ladies.
First thing. So I know you started, Colette, with the most magnificent head of hair and a ponytail so thick, rubber bands couldn't contain you.
Right.
And so what happens as we age is hair naturally thins. Think of your hair like a garden. You plant seeds and it lasts maybe 100 turns. But after a while, the seeds wear out. The garden is no longer as robust and the crop is getting thinner and thinner with time. So genetics have a role. Nutrition, again, that complicated answer. But for all of us, most of us will thin. The skin itself is thinning. You're no longer really at the early ages of 35 before menopause. The collagen production is just going downhill. So as you get older, we're turning into tissue paper.
Oh,
we're tearing.
I can see it on my hands.
Inside and out. If anybody touches something, you get bruises. That is collagen degradation of the blood vessels. So anywhere there's trauma, we bruise, but that is, again, you can see the collagen going down. So it starts earlier in females than males. They do a little better. The skin is a little thicker. There's ethnic differences, that beautiful fat pad and Latin skin, black skin. White girls, I'm sorry. We need some fat. Fat gives us cushion and gives that, genetic advantage. So all these are cofactors, but thinning of hair, skin, and nails, definitely changes in collagen inside and out, nutritional effects. So to put it all together, we can make a difference. We can help change that destiny if we can move some of those levers.
Okay, so we're all getting thinner hair. We're all getting thinner skin. I mean, I definitely notice it a lot on my hands. Are we getting thinner skin, Dr. Sarah, down here too?
Yes,
we are. Should we lean in?
Should we lean?
Did you know this?
This is where
yes, we are.
So what's happening down there to our tissue down there?
Well, as Dr. Kathy has talked about, what's happening up here is also happening down there. And one thing to add on to those changes is the loss of estrogen. So as we're getting closer to perimenopause and into menopause and we're losing that estrogen is very hydrating. It helps us keep our collagen, right?
Absolutely. Favorite vitamin,
right?
Estrogen.
Vitamin E for estrogen. So we're losing that, and that allows that tissue, our intimate tissue, to become thinner, drier, less lubricated, less blood vessel formation, and that can lead to pain with intercourse. It can lead to urinary tract infections, irritable bladders. So all of these changes are happening from head to toe.
Okay, so we're thinning here. we're thinning here and we're thinning here. I mean, we should just give up, right?
But sometimes we're not thinning
But we're not thinning right here.
We're increasing
Or here. Or on my arms. Okay, so we're
We'll get
thinning
to that.
here, and down there. Okay, let's start with here. What are we going to do about the thinning hair?
I really want to hear
Dr.
this.
Kathy,
Yes.
let's start.
What do
How
we
are we
do
going to
with our
fix
hair?
the thinning hair?
Great question. Back to the garden analogy.
Yes.
So when you garden, you need sunshine, you need nutrition, you need water, and you want to plant seeds and maybe do some raking. Okay, so if you just do one thing, topical minoxidil,
Great.
that's a start. We're stimulating the stem cells, we're turning on the seeds. Okay, good. But we need water, we need nutrition, we need sunshine. So depending on where you are on the journey, the answer is all of it. So nutritionals, I can make recommendations, but there are certain nutritionals that have clinical studies that help make the protein for hair.
So we're talking ingesting
Okay.
vitamins.
Yes. So
and
yes.
like, what would you recommend?
Well,
What's the
Great question, because biotin was in for
Right.
years, but biotin can mess up some blood work that we're
Mhm.
doing, and it turns out it wasn't so wonderful.
Mm.
And so it is a complicated deck. It is not a single ingredient, but a real collection. And so the two brands I do use would be Nutrifoil and Viviscal.
okay?
I prefer Viviscal because they're easier to take. Remember,
Right.
if it's a big capsule, you don't take it,
Oh,
it didn't
yeah.
help.
Yeah.
For sure. So we want a nutritional, we want collagen because we need building blocks.
So ingesting collagen.
So a problem today, women don't eat. And when we're in
Mm.
menopause, perimenopause, we're really trying to starve.
Mm,
And nutritionally, we're gaining weight, but the paradox,
Right.
mm.
we're not where we should be.
We're going to talk about that in a little
Right.
bit.
Losing muscle.
So-
Yeah.
Yes.
So putting that story together is nutritional, is minoxidil, either oral or topical.
For your hair. Okay.
And just to remind you, oral minoxidil is not FDA approved for women,
That's right.
but it's certainly in our world. In my office, we're using it every day, the very low dose, 1.25. And do talk to your doctor and your internist, particularly if you have high blood pressure. We're not concerned that's an issue, but let's be sure we're not in your case. So that's nutritional, and LED caps, the red light.
Oh, we love LED. We're
That's
going
right.
to talk about that
Well,
a little more
let's
too.
go right into it. A
Okay,
cap on the
LED.
head, if you're spare, women lose hair, 40% of us, particularly with babies,
Mhm.
we shed, we get androgenetic alopecia, just like the guys.
Mm.
And it's not talked about. Now you can go to a little wiglet that you can put on, or if you're thinning, if you see scalp, you're already 40 to 50% down.
Oh,
But if
Yeah.
you have a cap, the red light LED caps, that's your sunlight. It
Yes.
vasodilates,
Mhm.
and
in your
therefore-
garden, that's the sunlight. Okay,
Yeah.
I get it.
So now your nutritional gets out of the blood and into your seeds, which
Right.
help me with minoxidil, etc. And you can rake. These are fine or derma rollers, which we have at Rodan and Fields, but they're very tiny rollers with tiny needles. So we're not wounding you at all, but we're just
Oh.
making a break in the stratum
Oh, just
corneum.
like this.
Your
Okay.
minoxidil penetrates better. So now you're working, but when you work with me, your garden will grow and you
I
will see
love
growth.
that.
That's
I
such
love
a
that.
fantastic analogy.
Okay, so before we move on to the face, so we now know how to help our hair. You brought up red light. So red light is, again, what's near and dear to our heart.
Right.
So can you share from your perspective as one of the leaders in what we call an energy-based technology, red light, what is the mechanism of action? What is actually happening with red light?
So red light's been around a long time.
Right.
I don't know, probably 2 decades at least. And we were using it in wound healing specifically, and then trying to make collagen. So that's part of wound healing, but collagen production. It is not estrogen, our most important of all our vitamins. A patient always asks, what's the most number one thing to stop aging?
Estrogen.
Ta-da, from the
Yes.
crowd. So when you have LED, you're up regulating energy. in the cell.
Energy,
So it's
yes.
ATP, energy. But that up regulates really the whole cell function. So if you want regenerative or more youthful, big words here, that's what LEDs can do. And in our case with a scalp, we're getting vasodilation, up energy in the stem cells, and now they're back to producing better enzymes, better hair growth, better cell function, etc. Turn it on.
I love it. One of the examples I like to use is if you're a car that's aging and that battery is starting to die, and you use the jumper cables to get that battery going again, that's what red light is to our cells. It's helping get our cells to work again.
Yeah, exactly.
So that's what I like. All right, so
Okay.
we've got hair, face. What should we be doing for our face as we're aging?
Got 3 hours.
Estrogen on our face?
Well, estrogen's been tried for years, and it's interesting because you think it would take off in a nanosecond. Makes sense.
Right.
But I follow the clinical studies, and I'm not seeing it. So I'm not sure where the disconnect is, because I would have invented it, honestly. But nevertheless,
you would have done this.
I
2
would have,
decades
of
ago.
course. But for some reason, the problem, of course, is dosing. If you're dosing, if you're wearing a patch or vaginally, and now we're sticking it on at night, we could be overdosed.
Okay.
And so that's not a good outcome. So, be careful what you're playing with. These are real medicines. They do change structure and function. So not topically so much. You got to be very, very judicious, tiny amount topical if you happen to have it as a topical. But there's so much. This is a 3-hour potential answer. Number 1, 2, and 3 is no sun. I'm sorry.
No
Take your
sun.
vitamin
All
D.
right.
But the
Hats, sunscreen,
Please.
ladies.
please, any ethnicity, you're not helping at all. The sun really degrades skin. We know this, but people do it. They're out doing sports, whatever it takes. So please cover up, reapply. Clothing is my favorite. So less chemical, more clothing is ideal. But then all of our interventionals, and we're doing so many things, as you will be paying attention to our area in regenerative medicine, it's a new word, we'll be doing biomodulators. We'll be doing injections to, like the cell, up-regulate your own body to make collagen and be more youthful.
Oh, I
So
love that.
lots of products. We were talking before about Sculptra
Mhm.
is a biomodulator. So it's an exciting time with great news ahead. So
Lots of good
so
stuff.
stay young till we figure it out. We're on it.
Stay out of the sun.
Stay out of the
Help
sun.
me out here. Thank you.
All right. So, okay. Hair, face. Now we're going down to the V. Down
Okay.
here, what are we doing to help keep it young and healthy and that tissue plumped?
Yeah, that tissue needs plumping as we get older. So there's different things that you can do. We've talked about estrogen. Estrogen is the gold standard, but the red light therapy I want to talk a little bit more about and its specific effects on the V area. Can we say the word?
We can say
vagina,
vagina.
vagina. Sometimes we can't say it, but
There we go.
so I know. So the vagina is in the vulva, the external area, very delicate tissue. And as it loses its blood flow and loses that collagen, it becomes very thin. You might have experienced maybe chafing, maybe pain with intercourse, maybe bleeding, or maybe just lack of interest because there is no blood flow and you're not having orgasms anymore. They're not that great. So what can be done, what red light therapy does, and what I love about it is just what Dr. Kathy was talking about. It stimulates the cells. It tells them to turn on. It starts to produce blood vessel formation, collagen formation, elastin. And then with the V-Fit, I have it right here, what it also does is we have
and
the
V-Sculpt too, for
V-Fit and
because our
V-Sculpt.
audience is all over the world. V-Sculpt in other places.
right. I'm doing it incorrectly. I'm sorry. I was listening to you and talking at the same time. Hard for me to do that. So with the red light therapy, this also has a vibration to it. And we know that multimodal combination therapy with vibration and with the warmth that is generated from the light, that brings in more blood vessel formation and collagen and elastin. And so it helps the tissue repair itself and rejuvenate, and healthier, plumper tissue is what results.
I've got a patient story.
Okay,
Oh, good.
do tell a patient story.
Patient, wonderful, 45 years old.
young.
Painful sex, very young, very young. Had a little bit of experience with estrogen, but her doctor was not really interested in the problem of painful sex. So you can imagine her husband and her were not having such a good time.
Oh no!
So in
yeah.
this case, she has a V-Fit, and it was transformational. It was
Oh,
really
gosh.
life-giving for their relationship and for her own fear, because she wants to have relationships, but that
Right.
pain, who needs that?
Mhm.
This was amazing, which is one of the reasons I came on board.
I love hearing these
tested it,
stories.
Yeah.
Yeah.
and all my, again, was a gynecologist, loved derm, but loved to fix problems. And to see someone's life improve, to have somebody I never talked about this, but, I think I'm young to have this kind of problem. And indeed she is.
Right.
But that's how transformational her whole life can become when you fix such an important area.
Absolutely. So since we're on the topic of VFit and we have that wonderful testimonial, we do have a couple questions that have come in about VFit. So Barbara asks, I use HRT, which is estrogen. Will I still see benefits with VFit?
Absolutely. So if you're using a systemic HRT, that can be a patch, a pill, a ring that is affecting your whole body, you still may need therapy for the vagina. Systemic doesn't necessarily do the trick. So women still need some attention to that area. And even in addition to vaginal estrogen, I've had patients need to use the VFit and have amazing results. So yes, HRT doesn't mean that you don't need the VFit.
Great question.
It's combination therapy.
Yeah.
It's something Katie and I
point.
talk about with Rodan and Fields, but important for people to understand this is so complicated.
Right. It's not
So,
one answer, one solution.
No,
It's
we
multiple.
all want a magic pill or a toy or something, but the truth is we need it all. We need it all. And so they're additive for a result.
All right. Okay. Well,
love
we
that.
have kind of a different question here.
Okay.
But no question is off the table here. So, but it has to do with lax skin. Danielle asks, my labia is starting to look like my face gels.
Oh, wow. That happens.
Why is that? And how can I stop it? Or should I just accept it? And I'm afraid my husband won't be able to find my vagina with all the loose skin. Okay.
Well,
you're not alone, first of all.
No, you're not alone.
We actually
As a
heard that.
gynecologist, I have seen many labia that would be considered lax or loose. Women have talked to me about this. I don't know if you get this in the dermatology world. Women are often women are not satisfied with their body parts, including their vulva and their labia and their vagina. And I just want to put something out there that like all of your body, you should love all of your body. I mean, it's really important just in terms of self-acceptance and that we're not constantly trying to fix everything. That aside, labia become loose because of the things that we've talked about, the loss of collagen, the loss of estrogen. Runners actually have very loose labia because of the rubbing and the stress over so many miles.
I may never run again.
Exactly. If I had only known that, I wouldn't have started running.
So don't exercise because your labia will get too long. No, but it is very common. There's lots of reasons for it. What I find is that, the things that we've talked about, these multi-modalities combination therapy to help your tissue will help it improve. Red light therapy will help it improve. Some women are doing vaginal or vulvar rejuvenation. Some women are putting fillers in their vulva. So Dr. Kathy was talking about Sculptra. There's other fillers that we put in our faces. Some women are putting them in their labia. I would encourage you to talk to your doctor about it, maybe an expert dermatologist, an expert gynecologist, and be very honest about your feelings. I would also encourage you to talk to your husband about maybe you're not feeling as confident. And my guess is he doesn't care. He's happy to be with you. But that is what's happening, and it's very common. And red light therapy, lasers, estrogen, fillers, there's lots of different options there.
So along those lines, we also, Dee came in with another question very similar. She doesn't have pain with sex, but it does feel loose. So loose
Laxity.
Inside. So how do you resolve that?
So most women would know, especially if you've had a baby vaginally, that laxity just naturally occurs after a baby's head comes out of your vagina. It stretches the tissue.
Or if you've not had a baby.
Well, even with it, of course, but it's much more so with having a vaginal delivery. But even with a C-section, we have stress on our bladder, stress on the vagina. Weightlifting, if you're lifting very heavy weights, that can cause some of that laxity as well, especially internally. So lots of reasons for women to experience this. But again, red light therapy, estrogen, thinking about seeing a dermatologist for other cosmetic procedures as well. But yes, very common to have laxity. Kegels will affect the muscle and less of the tissue, if you know what I mean, in terms of your skin and the surrounding tissue around the muscles. Kegels will affect the muscle, but less of the laxity of the tissue.
I'm going to jump in because this is interesting. When I go to the Academy of Dermatology in the United States, big meeting, 11,000 people. This is never discussed. When I go to the Paris meeting, the international meeting, MCAS,
of course.
it's a different world. So the world is ahead of the United States. And so I've attended many lectures, and I'm one of the rare. The OBs are there. So this is the plastic surgeons, dermatologists, GYNs in the world coming in.
Mhm.
And this is new. This is breaking news. This is exciting news because my colleagues around town here aren't doing it. My OBs are not.
No.
And you guys aren't asking. You're not, because you don't know you can ask.
We don't know.
Right.
that.
You don't know what's going on down there. You don't want to talk about
Right.
it.
We're not
and
giving you permission to talk about it.
all of that. So this is new. This is breaking news that we can improve this whole area and give you confidence. And that is a game changer, because then you can participate and feel and enjoy it. But if you're very concerned, it's too loose, it's too this, it's too that.
Right.
You're women, we're mental. Okay, sorry. It's got to be working here or we're disengaged.
Yeah.
I
It's
mean,
true.
otherwise we would have killed our kids. But basically, the bottom line is you got to be focused and you have to be in the moment and you have to be receptive. And we have to have that stimulation, or we're offline and nothing's happening. So I'm giving you the good news. Dr. Sarah has breaking news that we're using these new modalities of fillers, of tighteners, different, safe, simple things to improve the look, quality, and function of your vagina.
And one of these days, very soon, America will catch up with Europe, right?
Yeah.
Is that's
a problem?
Well, we'll get there. We'll get there. Okay, we're going to circle quickly back to hair because I had a question come in about hair. So we talked a little about hair here, that we're losing it, but why are we gaining it here? Why are we getting those mustaches and those beards? And what's going to happen to the hair down there? Will that be thick like our chin, or will that be thin like up here? That's going on?
Great question. That's a really interesting, intricate question. I love it. So I'll speak to the hormonal part of the hair and on the face and add anything that you'd like.
Jump in.
But so when we have more testosterone than estrogen our whole lives, we don't really realize that, but we have a lot of testosterone. And as we lose in relationship to estrogen, and as we lose our estrogen, our testosterone levels, even though they're declining as well in perimenopause and menopause, they're higher than the estrogen. And then that causes these lovely stray hairs that you will feel occasionally.
Occasionally, I feel mine every single day.
So it depends on the person. But yes, that is the explanation, is the hormonal changes that you're going through with perimenopause and menopause. And women who are younger who have PCOS, polycystic ovarian syndrome, they always have higher androgen or testosterone levels. And so they're more likely to have hair growth even younger. And then that can worsen with age as well. Do you want to add anything to that?
Completely agree.
Okay.
That's what's going on. The balance has changed, so we're a little more male, which is no fun at all, because we're not getting any of the sexual excitement, but we're getting the hair. And we're getting hair thinning.
Although we're better at speaking our minds.
Oh, yes, indeed.
So-
We've been talking offline, can you tell? So therefore, we start to grow whiskers. And if it's black hair, dark hair, we can treat it. We treat it with laser. And the reason is, if you have, I'm trying to see if you can see, but let's say I have a black hair on my white coat. You can see my pants. Okay, so but black hair on a white coat, the laser can detect it. But if you have a dark hair on dark skin, can't see. And so we have to use lower energies to try to remove hair. So if you have a gray hair, can't see currently. Right. So we can treat facial hair. It's better than electrolysis. It can be removed.
Life-giving.
Life-giving. Yes, do it.
Yes.
But now let's go down to the vaginal area.
Yes.
Now, a lot of you have been doing these very impressive hair removals down there. Is there a consequence? Because I have an idea, but tell me what you're seeing.
So what I'm seeing is that with removal of all the hair, as a woman ages and there's less lubrication and there's more dryness there anyway, then that leads to more chafing, more urinary tract infections, less hydration.
Without the hair.
Without the hair.
Interesting.
Yeah.
Okay.
Really important. And plus, you know, if you're losing that fat mass on the labia,
right,
and you don't have hair to camouflage it,
it may not look as attractive, is what you're saying.
So you yourself are seeing
it more. You notice it more.
Notice it more.
Right. You may not never notice. You have nice bush down there. Everything's looking good, but you know,
the bush hides the loose labia, ladies.
Well,
let's just be real.
Hey, Just saying.
Maybe the bush will come back.
Can the
Maybe,
bush
Indian
grow?
style.
Can we put some of the red light down there for the bush?
Everything is possible.
Everything is possible. But hair down there will, especially in older women, does thin, right?
Yes,
The hair-
absolutely.
Oh, it does thin.
It does.
Okay.
It thins. You don't get more as from the androgen.
You're not
levels,
getting
it
the
thins
whiskers
out.
down there.
No.
Okay. Jackie, thank you for asking
That is
us
a
that
great
question.
question.
That was a really good question. Okay. We are going to talk about another fun topic that comes up, and one, Kathy, that you and I have discussed many times: to pee or not to pee.
Mhm.
So we're going to talk about incontinence. So, Dr. Kathy, tell us what is happening with women in menopause that is causing them to have incontinence, which is that accidental loss of bladder leakage.
So I'm going to have Dr. Sarah answer, but I'm going to give you a story.
Okay.
This was eye-opening. A few years back, there were 15,000 people at a Rodan and Fields convention.
Wow.
And we had a keynote. Katie and I were done. We were in the front row watching a keynote, motivational. And she got out there and she said, everybody jump up and down. And it's in an arena, a bowl. And suddenly there's a roar. My husband goes, what just happened? And then laughing. And she said, who peed? And everybody lost their minds. And he goes, what happened? What happened? What happened? And I go, you just got the dirty little secret of every female, all ages.
Yes.
And first of all, he was shocked because I had to explain it. But everybody in the crowd got it. That's the magnitude
Right.
in one room. I'm sure at a Taylor Swift concert, same effect.
Same
Right.
Okay, the little girls were fine. But nevertheless,
There you
now
go.
the question is, what's going on?
Why?
What's going
Why are we peeing our pants?
Well, we're peeing our pants for lots of reasons. And to Dr. Kathy's point, if you're peeing your pants, you're in very, very, very good company, because most women are having some sort of bladder issue as we age. And that can be, again, we talked about childbirth, the stretching of the muscles and the tissue leading to laxity and decrease, muscle strength. Loss of estrogen, that causes our bladders to be more irritable. We were talking about irritable bladder before this, where you feel like you have to pee. I just peed, I got to pee again. Very, very common. And then just leakage with jumping, coughing, laughing, standing up, walking over off a curb. So very common, and it's lack of estrogen, tissue laxity, muscle strength loss, and there's things to do about it. Again, like we have solutions with all this bad news. We do have a lot of solutions.
And one of the questions that we have about this is, we've all been told to do our Kegels since we were young, but it's not just about Kegels as we age. Isn't that
It's
correct?
not just about Kegels. Kegels are important, but it depends on the woman, because some women actually have too much pelvic floor tightness. So again, it's a conversation with your provider about what your issue is and testing those muscles. But Kegels are great for tightening the sphincter and your vagina surrounding your rectum and your urethra, building up that muscle tissue. But it's not just the muscle, it's the surrounding tissue. It's the collagen, the elastin, the blood vessels, the blood flow, and the lubrication to that tissue, and the health of the tissue that matters as well. And again, that's where red light therapy comes in and really helps promote the blood vessel formation, the tissue healing, and its therapeutic benefits can really help.
That's great.
You know-
So even though Nancy says I'm already in menopause, is it too late to do anything about my pelvic floor and my
Oh
incontinence?
no, never too late is what I would say. It's a matter of talking to your provider, seeing a pelvic floor physical therapist, trying V-Fit, looking at estrogen to help reduce urinary tract infections, get that hydration into that tissue. No, it's not too late.
Great time to educate all of us about bladder hygiene.
Yeah.
I mean, just how to pee, please.
Well, no, I think you did it awesome before.
Okay, like my version?
Yeah, she did a great
All right,
version.
but she'll
before.
jump right in. So basically, when you go to pee, stay there a minute. Don't pee and jump up. There is retention. There's always a few cc's of fluid left in the bladder. But if you just jump up, you start to have retention and you get more and more over time, which is torture, because that's part of this bladder spasm. So one is drink, please, and then pee. And wait and really get that last drop out. Number two, if you're up all through the night, stop drinking at a reasonable hour, like at 8 p.m. Drink, but definitely cut yourself off mean, having something at 10 is kind of dumb because we know
And we're
you're-
talking about even water,
even
folks. Right?
yeah,
Not-
mostly water.
Yeah.
I don't, whatever fluid
Yes.
you want to talk about, but never
even a glass of water.
Yeah, even most importantly, water. If you're drinking late, you're going to have to get up to pee. So those are 2 hygiene moves. Okay, go.
Okay, one thing that about the peeing part is make sure you pee. Because women, whether we're working, we're mothers, we're whatever we're doing, we tend not to go to the bathroom frequently enough. We'll go all day and go, oh my God, I haven't peed all day. I used to say that all the time at work. I haven't peed all day. Oh yeah,
The
I never
queens of
pee.
no
I
pee.
never pee.
They
It
don't.
was terrible.
They never pee.
So what can happen is your bladder can stretch then, and then it becomes more spastic as you get older. And that's where you feel that, oh, I gotta go, I gotta go. So make sure you do pee. I like to tell people no longer than 3 hours. And if you're having bladder leakage from spasming, then you may want to just start every hour and a half all day long and then build up to 3 hours, but no longer than 3 hours is my
Great
rule.
advice.
Yeah.
Really good
Thank
tip.
you, you too.
Great. Well, I love it.
retention.
That's good. If I just want to remind the audience, if you have any questions, please send them in and we will do our best to answer them. Okay, we're going to move on from to pee or not to pee, and we are going to go into let's talk about sex. And I feel like we need that. What's the band TLC? Let's talk about
No,
sex.
Salt and Pepper.
Salt and pepper. That's it. Salt and
How old
pepper. I'm really old. That was brain fog. That was
Menopause.
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 Let's talk about sex, baby. Okay, let's talk first with Dr. Kathy. Sex changes after menopause. It just does. We either lose desire or we just don't feel the same anymore and we stop doing it. But you're here to tell us that it's important to keep doing it. Why is that?
Because even though physically the evolutionary purpose of making babies is over, physically we are being erased, we're turning gray, we're shrinking in our body size, our skin is hanging, etc. We discussed all the ickies. But you know what? We're still humans. And you can still be satisfied and you can still really enjoy your spouse, because some of the stresses that slowed us up, like having a lot of kids around because there's no quiet time, suddenly you get it back. And you can get it back and it can be better than before.
Mhm.
And there's a comedian, I can't think of which guy, I'll remember in a minute, here in the Bay Area, who talked about how he re-met his wife. He goes, oh my God, she's crazy hot.
I love that.
Okay. Now remember, for us, very mental, always mental. And so you got to work on both sides. You got to feel good about your body, which you can. We can help you on estrogen. You can feel good lots of different ways, but you've got to mentally now understand you're still sexy. You still got it. You can enjoy, you have permission to enjoy your life, not inhibited. Now, culturally, there's a lot of overlay here. How you were brought up, can you express that you're enjoying sex or not? There's so much underneath all of that. I am not a psychiatrist, but I do know a great OB-GYN who can help us understand how to be able to enjoy our lives even when we feel we're done, because we're not. Go ahead.
And that's you, Dr. Sarah. So please
Yeah.
share with the audience if you have any tips or suggestions on helping them get back into the mood, or of course, if they're suffering from pain or challenges, we kind of touch base on that, some of the
Right.
products they can use.
Well, I think what Dr. Kathy has brought up is really important, is understanding your beliefs about sex as you age. What did you believe when you were younger about older people having sex? Kind of understanding that process of it. And I'm not a psychiatrist either, but we do know for women that, and for men, but for women, sex is complicated. There's lots of things going on. It's our physical response, it's our mental and emotional and psychological response. So everything you said, I just am so glad you said it. Physically, I'd like to talk to women about estrogen, testosterone, thinking about what feels good in your body when you're with your partner and focusing on that. The other thing we talked about earlier is that men have their own issues too. We don't think that they do, but they really do with age. They have their insecurities about their bodies, their penises, their everything, and their performances. So I think being honest with your partner, if you're in a safe, comfortable relationship, which I hope you are, and being able to have those conversations is really important. Personally, I found the V-Fit works great. My patients love it. And what I like about it is that it's the blood flow issue. So orgasms and your libido, besides starting up here, libido is also blood flow, right? So if you're not feeling the blood flow to that area and you're not feeling the lubrication, then it's sort of like, what's the point? And then if your orgasms are not great, and that also is a blood flow issue as well as a hormonal issue, what's the point? So the VFit brings in the blood flow. Testosterone brings in the hormone stimulation as well as the blood flow. So that combination for most of my patients works amazing.
Great. And in fact, we got a question that just came in about VFit from a name, and I apologize if I mispronounce it. It's a beautiful name. Asteri, did I get that right? Asteri, she asks, what is the difference between using VFit versus a suppository such as, I don't know this brand name, but other products that you insert that have hyaluronic acid, which we know is a wonderful ingredient for moisture binding, or that has moisture binding properties.
Yeah, there's different products that you can use for different purposes. So a lubricant, an intimacy gel, those are helpful during intercourse, and that's what their purpose is. Some of them will provide longer lasting moisture, like our Let's Spin does, because we have hyaluronic acid in it. Hyaluronic acid, and the dermatologist will definitely speak to this, retains water. It's basically a water binder. And so if you put that suppository in the vaginal tissue, it's going to retain water. And so it does maintain the moisture in the vagina. What it doesn't do is change the thinness of the tissue. So estradiol or estrogen, red light therapy, those types of modalities, maybe testosterone and DHEA, hormonal modalities and red light therapy, they're dealing with all of the components of the vaginal tissue, the lubrication, the hydration, as well as the tissue itself becoming more plump with more blood vessel formation and collagen and elastin. So that was a long answer, but I hope it answered your question.
Oh, it's a great question.
Yeah.
We have another one that just came in, and this is from Jana. And she'd like to know, and for either of you, how do you know if things are feeling things are feeling off? Is that due to menopause, or is it another health issue you may be experiencing?
Well, that's an excellent question, and something that I'm glad you're asking and should be discussing with your provider. And again, we've talked about it. It's complicated. It can be your thyroid and menopause. It can be depression and menopause. It can be relationship issues and marital issues and menopause. So the fun thing about perimenopause and menopause is it does affect most of our body from head to toe, as well as our mind and our emotions. And so if you're of a certain age, typically in your 40s and 50s and beyond, perimenopause and menopause is likely having some effect. But an open, honest, direct conversation with your provider and, maybe getting books on perimenopause and delving into it can help answer some of those questions for you and your personal history and what you're going through.
I'd like to say this, permission to ask. My patients don't feel entitled to know. They push it off. Oh, I was cranky today. Oh, I just didn't sleep. Oh, whatever the excuse. Instead of saying, gee, I wonder if I can feel better. I wonder if I feel bad. Is this off?
Right.
And there's no one to ask. And that's hard because you can't just call your GYN and say, hey, I haven't slept in like 4 days and I, ate my children and my husband and I'm not invited back to that party, whatever. So the bottom line is life is failing. You're not thriving. Could it be menopause? Could that be part, or is it my thyroid? Is it different other hormonal issues? So permission to lean in and ask. As we know, it's hard to get healthcare today. In the United States, let's be clear, healthcare is difficult. There is indeed denials. You don't get adequate time. We don't have the time. We're on a schedule. We are now really employees of the wheel in Medicare and certainly in insurance companies. We're on a clock. I got 10 minutes to see you. Not me in private practice. I'm lucky.
Not me.
But for most of our colleagues are on a clock. They're employees of the wheel and they honestly don't have the real time to invest. Therefore, you take control. Therefore, you be the one to be proactive, read the books, ask the questions, and please feel entitled to have real answers.
Yep.
Seek answers. We can know what your hormone levels are. We can help you understand where the imbalance is. So it really is permission to take control, even if it's a lightweight problem that you're feeling, well, not so great. It's okay. No, 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 no. Please lean in. Our job is to give you a soft landing. We can help you have quality of life that impacts not just your vagina, but your whole world, your family, and everyone around you. So we're really encouraging you to take control.
I will just add from the non-physician over here, I think it's important you have that dialogue with everyone in your life. If you start with your girlfriends and ask them what they're experiencing, you can learn things that you didn't know could happen.
And get validated.
But you're validated, and you also learn that you're not alone. Chances are that they too are experiencing the same or similar issues. So start having the dialogue with everybody, your partner, your friends, of course, your doctor. But the more you talk, the more you will learn.
I'm going to add two more things that I just want to bring up about women is that one, we're used to suffering. I think that whether it's when we're pregnant or postpartum or breastfeeding and not sleeping, whether it's from that or workplace issues, women are just accustomed to not complaining and just taking it in stride. I would encourage you at this point in life to not do that anymore. And as Dr. Kathy is saying, to say something and advocate for yourself. The other point I'd like to make is women really know their bodies. Most women are very intuitive. We understand what's going on. And so if someone's telling you, oh, it's not perimenopause, or, oh, your hormones look fine, and you know something's off, talk to someone else, find someone else.
Great advice.
We just got another question in, and this actually we get asked quite a bit, and it's from Marta, if I pronounced your name correctly. She asks, what if you can't take estrogen? Because we've been talking a lot about how wonderful estrogen can be. What if you can't take it because of a medical issue? What can you do?
There's other options for not taking estrogen, and it depends on your medical issue. So if you've had a blood clot, or if you have high blood pressure, there are some types of estrogen that you may be able to take. That's transdermal. And that's a discussion with your doctor, obviously, and specialized to you personally. But when we avoid oral estrogens, a lot of the risk of estradiol estrogens goes away. So it depends on your particular case. Breast cancer is a different animal. There's some data that if you have what's called a triple negative breast cancer, estrogen may be okay. If you're further out from your diagnosis and treatment, estrogen in the future, as well as progesterone, may also be okay. So it's very nuanced depending on your particular medical history and what's happened in your body. But every woman deserves a conversation about estrogen is what I would say, and not just say, nope, not for you, that's it. In terms of other options, there are estrogen receptor things, supplements, and other things, what am I trying to say? Plant-based options that can bind to the estrogen receptor and give you some relief from the symptoms that you have from having low estrogen. So that can be looking at different soy products, different supplements, specifically for the vagina. We talked about the hyaluronic acid, the VFit. One last thing is most women, regardless of their condition, can use a vaginal estrogen, including breast cancer. It's E-string, vaginal cream. It's been shown to reduce mortality, actually, in a recent study, if you've had breast cancer and you're using vaginal estrogen. And that comes from not dying of sepsis from a urinary tract infection and some other things that can go on when we don't have vaginal estrogen.
Brilliant advice. Really important advice, because I see that where patients go, well, my doctor said I don't need it, or you can't have anything.
Yes.
And that is not true. So an E-string.
Speak to another doctor.
Yeah, speak to another doctor.
Opinions.
Read literature, but an E-string is an advantage. If we can keep that pelvic floor strong, vaginal tissues healthy, save us from this urinary incontinence nightmare.
Okay, I have one more question before we switch to GLP, because we know that is a hot topic and we want to hear from the experts on GLP. But Linda wants to know, should you be on progesterone with estrogen if you no longer have a uterus or ovaries?
That is I would say that answer has varied responses depending on who you're talking to. So in my world of OB-GYN and functional medicine, I believe many women can benefit from being on progesterone. Progesterone is an anti-anxiety hormone. It is an anti-bloat hormone. It is this pro-sleep hormone.
And we love our sleep.
We love our sleep. So I am a big proponent of women being on progesterone when they have a Mirena or other progesterone-releasing IUD, or if they've had their uterus removed and they've been told they don't need to be on progesterone. If you are feeling great without progesterone, great. There's no reason to absolutely demand it. But if you are still not feeling as wonderful as you'd like to, your sleep is off, things like that, I would encourage you to investigate progesterone.
Great. Okay, keep the questions coming, but we're moving on to GLP. And so for those of you that don't know what that is, you may have heard some brand names out there, Ozempic, Wegovy. The generic is called a GLP. We're here to talk about that because it has such a big effect on menopausal women and even on intimacy. And of course, Joylux is a company all about intimate health. But if you're not feeling your best, if you're not looking the way you want to look and you're not confident about who you are in your body, that may be one reason you're not engaging in intimacy. So we are going to talk about GLP and the benefits and why you should or maybe not use GLP. Who wants to take it off?
Well, I'll start with weight. Just weight. Weight has a set point. And when you start to get into menopause, suddenly, for some, your weight can balloon. So it may be the thyroid, but it may be you're in peri or menopause. And as a result, you could be down to lettuce. You could be starving and you're hanging on to every calorie that's going in. And your body is just getting bigger. And once it has this max set point, it loves it there. So even if you diet, exercise, run around like a nutcase, but then you eat, you just get bigger. And so in menopause, this becomes a real horrifying experience because your body is changing and it's out of your control. So we were talking about back fat, arm fat, belly fat, mid spread. What the heck is going on here? And again, nothing changed except they did. Your hormones tanked. So that's the start point. So we'll jump into fat. Back to you.
I would absolutely just emphasize that to validate your feelings about why am I gaining weight? Because almost every single woman comes in to talk to me and that's one of their top pain points. And it's not just based on vanity or, oh, I don't look the way I used to look. I don't feel the way I used to look. I've experienced it. I'm sure you both experienced it. It's just this, what happened? And
sometimes it happens overnight. Like
within
you went into menopause and 6 months later, you've gained 20 pounds and you have no idea why.
Right. And just even perimenopause. So it's very frustrating. It's like Dr. Kathy's talking about, it has to do with age, metabolism, hormone changes. So I just wanted to emphasize that validation that you're not crazy and you're not doing anything wrong necessarily. I think that's important to hear.
Okay. So what is GLP and what is it doing to your body?
Yeah. Right. Complicated. So we without going too detailed, basically, this is a revolution. This is a sea change in medicine. So let's say penicillin was a big deal last century. Let's say Botox, which I use for 200 different diseases. It's fabulous. It's not just for vanity lines. It's for all kinds of interesting, horrible conditions. So I'm a huge fan. But now, say statins were good for heart disease. Now there is something that's hit the world in a way that is different. Different because we're aging, but we're living longer with chronic disease, heart disease, stroke, pancreas, kidney disease, joint disease, everything. So great. We're a sick old bunch of people. But this classification of drugs works on the brain and on the gut and clearly everywhere else in the body. And what it's doing is remarkable. The studies are coming out, not with a few hundred or a few thousand, but one recent 1.3 million people taking this category of drug, GLP, and we are dazzled.
And it's tricking your brain into believing that your stomach is full.
Yeah. And clearly more is going on than that. But we're not seeing an uptick in side effects.
That's
now,
great.
if you're going to, go on breaking news today, somebody died from, a GLP. Yeah, there's always a few, but really now this is not a new drug. The GLPs have been around now for a while, and the next generation is coming, and more safety validation studies are coming out because the magnitude of people on it is really something. So it's going to be a baseline medication, really starting with children. And again, we all know ultra processed foods are keeping us fat. Pops, sodas, sugar, etc. This is a sea change. It is remarkable in what it can do. But you don't go online and get it from Canada without good medical supervision. So please be careful. This is not go online and shoot up, please.
And it's not go online, shoot up, and then don't take care of yourself.
Yes.
So nutrition and exercise is paramount always.
Yes.
And even with the GLP-1. So I have a few patients who have been on it that weren't exercising and they've lost muscle mass. And then that leads to other medical issues, sarcopenia, falls, broken bones. So it is important to be aware of the risks to your muscle mass and to how you're eating, because you don't feel like eating. Oftentimes, so you really do have to continue to eat and eat healthy.
Eat
protein and do weight-bearing exercises. So important.
And other side benefits. You don't want to drink. A lot of obsessive compulsive behavior, again, brain gut connections seem to change. So gambling is down. Sorry,
that's
Vegas.
right. And Vegas is reporting a decline in gambling and
eating because
of the
drinking.
GLPs. So so not good for Vegas, good for you.
Something to consider.
Yeah. I had one more question come in. And I before I give this question, I want to say that the internet affords us a wealth of information. A lot of it is good. A lot of it is bad. We are sitting here sharing our stories, our experiences, but nothing replaces speaking to a medical practitioner. So first and foremost, if you have a medical related question, really do speak to your medical professional that knows you and what your body is going through. So with that, this person asked, there's a book saying you shouldn't eat estrogenic foods like garlic, nuts, and seeds. Is that true? And both of you.
I would say no, that's not true. I mean, depending on your gut health and if you have different things going on that cause bloating and other things, but foods that bind to the estrogen receptor, such as soy, for example, as long as it's organic, non-GMO, non-modified foods, those can be beneficial. There's nothing wrong with binding to the estrogen receptor. It's what happens after that. And so typically foods that are organic and healthy for you, such as garlic, such as edamame, soybeans, those bind and have a positive effect on what happens after they bind to the estrogen receptor. So any book that is saying like, don't ever eat this food, I would not put stock in personally. It's a much more complicated discussion about foods and estrogen related foods, but even women with breast cancer it's been shown that eating soy does not promote breast cancer.
So when in doubt, again, speak to a professional, a medical professional that you trust and that knows your body. Okay, we are almost coming up here on our hour, which is unbelievable because I think we could all continue talking. So in fact, there were quite a few questions we did not get to. However, I'm going to leave with one last question, which is if we could all go back to 30 years or to our 30-year self, because I'm only 35, right? So not 30 years. I'm just kidding. I'm not 35. But if we could go back to our 30-year self and give her one advice about what she can do to better prepare for aging or menopause, what is it?
Just one.
Well, just one. We don't have time for all of yours.
I have so many things I would tell her.
I'll start with me. Isn't directly related to menopause, but it is aging. Is all throughout my 20s, I wore high heels everywhere. I wore them to work. I wore them out. I'd be sitting at a desk for 8 hours, but wearing high heels, and my back and my knees are paying the price today. So I would have worn more flats in my 20s and 30s to avoid the pain that my back is going through in my 50s today. So that's my one advice.
All right, one advice, dermatology. If estrogen is the fountain of youth because it keeps your eyeballs juicy, your guts juicy, so you don't get constipated, dry eye, better hair, better joint function, better cognition, that's your brain. So from all the way head to toe, the other thing is sun avoidance. I gotta say it. Sorry. People say
no more
I,
baby oil
no,
with your aluminum.
So what happens is, yes, no, I'm looking. Anyway, so bottom line is it does matter. Any ethnicity, the sun really is not your friend. If you need vitamin D, please eat it, depending on your blood levels, don't just huge quantities because it will get into your fat and stay there. So there is too much of a good thing, vitamin D. But do please avoid the sun because it's so simple. Look at the skin on the top of your arm and flip your arm over. And you can see this is fried and this is beautiful. And so if you look at that difference, if you had started way back, that wouldn't be such a trade-off. And so for your face, which we're all trying to protect, really apply sunscreen, reapply sunscreen, and understand a cute tan isn't. And those freckles you weren't born with, you earned them. You got roasted starting as a small kid. Can you repent? Yes, the body can repair itself. So start repenting now. Give it up, please. Thank you so much, my word.
Okay, I'll do it more of a psycho-emotional one. I would have been way nicer to myself. Since probably before 30, I would not have been so critical of my body. I would not have been so hard on myself. I'd have been like, girl, you have it going on. I just have been a lot more sweet to myself. And then, because I'm learning that now at the ripe age of over 50, but I think it's important we do that.
Yeah, I think that is really important.
So ourselves.
Be kinder. Stay out of the sun. Don't worry.
And we're going to leave it right there.
Yeah.
I think the end is, this is us having a dialogue, and you are unique, and you need to speak to your own professional as we speak broadly about things going on in the world today. But you need to look in the mirror, decide, really be honest with yourself that you want to make a change. You want to feel better in your life. And there are professionals out there to help you.
Okay. Before we end though, I did get one question. I think that's really important because we have been talking about speak to your professional, speak to your doctor, but there are some situations where it's not realistic for a woman to reach out to a doctor for many reasons, where she lives, her home situation. I mean, when you have a lot of kids, it's hard to even take time to go to the bathroom.
Yeah.
So where can you go for resources that it's true information? Because I want to remind you all out there, and we see it every day in the news cycle, there is a lot of misinformation about everything on the internet. So when it comes to women's health, and you don't have access to a doctor or the ability to see a doctor or talk to a doctor, where do you go?
So this is a really important question. I hear this a lot in our work and the other work that I do with Halle Berry about patients in perimenopause and menopause, is where do I go? So first of all, there's some books that I would highly recommend. And then there's a couple of healthcare companies that are nationwide and that do accept insurance that I'd recommend too for hormones. It may not be as personalized as you want, but it's a good starting option. So the books, looking at Dr. Mary Claire Haver, she has a very deep, in-depth book called The New Menopause. Lots of information. That's a great starting point.
And you can get it at the library. We don't ever use our library as much as we should, but that's free. So use your library.
She also online has a ton of resources, free resources that you can go to and learn a lot. The Estrogen Matters is a great book about estrogen and its effect on breast cancer, or what kind of delves into why is it so important. That's by Dr. Avril Blooming. The Next Level by Stacey Sims is a very great book on exercise and nutrition and menopause. Very helpful. Those are the big ones. Oh, the last one is The Menopause Brain by Lisa Mosconi. Great book on what happens to our brains and longevity and aging. And then MIDI Health is an option, an online option for telehealth care for insurance base that's covered by insurance. Yeah. So
And I would say, when in doubt, this may get a little dry, but there's a lot of published papers that are peer-reviewed, that are easily accessible on the internet. So if you do have a question about something, Google, it's called PubMed, and that is a free resource of published clinical papers where it's doctors like Dr. Kathy or Dr. Sarah who are doing research on topics. That's free. You can read it, and that's coming from the source, coming from the experts. So there is a lot of free advice and resources out there. Just make sure they are coming from credible people.
And
So
just the last is go to our academies. The Academy of Dermatology has a public-facing site, great place to start. Is Retin-A good for me? Yes, no, etc. So the same thing with OBGYN. Go to the Academy website, and that's a safe place because they are talking about what we're talking about. And so that it's not TikTok, it's real.
Exactly. That's great. So with that, thank you, all of you who tuned into this great hour. Again, I'm just honored that we had such incredible minds. Like, you have no idea the brilliance we have sitting next to us with Dr. Kathy Fields and Dr. Sarah Dillatore. It's just two incredible physicians that have given their time, not only today, but every day, really helping women improve their quality of life and be the best they can be. And that's what Joylux stands for. We are all about empowering women to live their life confidently with access to the best tools and resources possible. So thank you for joining us. Tune in next time when we have another panel on whatever the next topic is. But thank you, ladies, for being here. We just so appreciate your insights and you sharing your stories.
Thank you.
Thank you.
A lot of fun.
It was